Good evening, everyone. I welcome you all on this webinar on low back pain evidence-based approach. I welcome and thank Swarn Lata ma'am to come and join for this noble cause. So, ma'am, you can start the presentation.
Okay. So I'd like to say thank you to Bilal for giving me opportunity to present this topic. So first of all, I would like to introduce myself. I'm Swarn Lata, and I have completed my bachelor's and master's in orthopedics from NILD Kolkata. And right now I am working as a in NTPC Hospital Sipat. Okay. So today I'm going to discuss about low back pain, which is evidence-based approach. So when it comes to low back pain, what is low back pain? So low back pain is defined as a pain or discomfort in the lumbosacral region localized below the last rib. 1 second. Okay. So localized below the last rib and above the gluteal crease with or without refer pain. It is basically the pain which occur at the lower back region, and most of us faces low back pain once in a life. Okay, so the prevalence rate or epidemiology for this low back pain is 50% of all adults have low back pain every year. 15 to 20% seek medical attention, and according to Lawrence C. and Associate in 2017 reported that the prevalence of low back pain gradually augments 11.4% each year, and between 60 to 80% of the population will encounter this problem in the world. So now we are going to discuss about the natural history of low back pain. So most of the low back pain improve, that is 70% of the low back pain improve within 2 weeks. And apart from that, 90% improve within 6 to 7 weeks, and 3% do not improve within 6 to 12 weeks. And this 3% patients basically are the 50% of low back pain patients, due to which it is very costly for them, or this treatment is very costly for them. Okay, so now when it's come to classification of low back pain, it can be on the basis of duration or etiology. Right now I'm going to discuss about the classification on the basis of etiology. There are two kind of back pain, that is non-specific, which means there is no specific reason for that, and we cannot identify the cause of the pain, but the patient will feel the pain. That is why we have kept this category as a non-specific. And another one is a specific category. It is related to the specific pathologies and can be diagnosed early through warning signs, including neoplasma, infection, vascular, metabolic, and endocrine related. Okay. So some of the specific cause of low back pain are like the cause of pain in specific condition can be occur due to sprain or strained ligament, tendon, and muscles. Second reason may be herniated disc and spinal stenosis. Apart from that, if the patient has degenerative disc disease, then also he can feel this low back pain. Spondylosis and spondylolisthesis are also the reason for the back pain. Then facet joint arthritis. Apart from that, if patient is feeling sacroiliac joint pain, or if he is having osteoporosis or ankylosing spondylitis, then also he can feel pain. And some arthritic cases like osteoarthritis and rheumatoid arthritis, the patient may feel pain at his back. So when it's come to risk factor, what are the risk factors due to which we can feel the low back pain? If our first one is occupational hazards, like if we are doing some work and some heavy thing just fell on us, then it's come under occupational hazard. Then it can cause you a back pain. Apart from that, if you are doing some sedentary job, then you may feel back pain. If you have weight gain, or if some patient is over 60, then he can feel back pain. Generally, women are more prone to low back pain than men due to osteoporosis. And apart from that, spinal canal shape and size are also contributing factor for risk factor for low back pain. Smoking can also cause low back pain. If you are driving from prolonged period, then you may get back strain, and it is also a risk factor for low back pain. Stress and other psychological factors and strenuous physical labor activities can also cause your low back pain. Strenuous physical labor activities examples are like if you are a worker and you have to lift a brick from ground to your head, then you may get, while bending down, you may get some back strain or back pain. Okay, so now, as we all know, back pain is most common among people who are out of shape, especially weekend warriors who engage in various activity after sitting around all weeks. So the basic thing is, if you have gained more weight or you have more pounds, then you will feel more pain. Okay, so just listen to your body. Now it's time for the physical examination. When a patient comes to you, what you will do? So first thing, you have to evaluate his medical history. Okay, you have to ask the patient about, like, from when he's feeling pain, where is his pain, and what kind of nature of his pain is, whether his pain is radiating or it is just concentrated to one point. Okay, the next thing which you have to ask the patient is his extra spinal cause. Okay, then after asking this, you should know the red, yellow, and blue and black flags of low back pain. Okay, I will tell you about red flag after a few minutes. Okay, but just come to this physical examination, like inspection. When the patient comes to you, you have to inspect his lower back, and you have to palpate his lower back. You have to check his temperature. Okay, you have to see whether there is any swelling or not. Okay, and after doing, you have to just ask the patient to do movement. Like if he has come to you with back pain, then you have to say the patient that you have to bend forward and backward. And as a physio, you would just notice the movement and just say the patient that if you are feeling pain, then stop then and there. Don't try to exaggerate the pain by moving or bending. Okay, so after testing the movement, you will do some special tests, like you will test the straight leg raise or SLR. Okay, you will do some special test, and after doing that, you will check the SI joint or joint play of back. Especially, it would be better if you will check from lumbar region to sacroiliac. But if patient is complaining more pain at a specific joint, then don't touch that area. Okay, because you don't know, if you are testing a joint play, then you can unintentionally you can injure that area. So just stop. So if patient is telling you that he's feeling some radicular symptoms, like he's feeling pain down the leg, then you will conduct some extra neurological examination. You will test his lower limb strength and also back strength. And after that, you will test his sensations and muscle reflexes. So as a physio, these are the 5 points which we should focus while examining the low back pain. If a patient comes to you, then you have to check his posture and gait. Okay, you have to see whether he's having scoliosis or not, whether he's having flat back or not. Okay, posture will tell you many things. So if his posture is wrong, then you may you can just identify his pain cause by looking at his posture, like which muscle is tighter and which muscle has been shortened. Okay, so posture is most important thing for low back pain. And after examining the posture, you will see the gait pattern of patient. Like if he has come with antalgic gait, so you can just see that his pain is more or less, or he's just mimicking the pain, or he's just something like that. Okay, so the next thing which you will see is range of motion. Okay, you will ask the patient to bend forward, to extend his trunk backward. He will do some lateral flexion and rotation. If the pain increases by flexion, it will reflect usually a mechanical cause. Okay, which means that he's doing repetitive movement for several times, like he's doing repetitive forward bending, due to which he's feeling pain. That is called mechanical cause. Okay, and if he's doing extension and still pain persists, then it will indicate the spinal stenosis. And after doing the range of motion examination, you will palpate the spine. If you, while palpating, you will feel tenderness, or if you have just touched the surface or skin of the patient and patient just become apprehensive, then you have to stop. It may be so don't proceed for the examination. Okay, you have to stop then and there. The next thing is paraspinal muscle tenderness. If you will see that, it will indicate you a muscle spasm. Okay, after examining the range of motion and after doing palpation, you have to see the gait pattern of the patient, and you will just ask the patient to do heel to toe walk, squat, and raise. Okay, if he's unable to walk heel to toe, or he's unable to do squat and rise, it may indicate the quadra equina syndrome or neurological compromise. After doing this, the most important thing is special test, that is straight leg raise. Okay, in this we can differentiate that the pain is neurological or not, it is radiating or not. So it is very important for us to do SLR when patient come with low back pain which is radiating down to his leg. Okay, so earlier I have told you about red flags. So what are the red flags? Red flags are the signs and symptoms related to the screening of various underlying pathologies mimicking a musculoskeletal pain. If you see a red flag, then don't examine the patient. Okay, don't. Okay, because if you will do some physical examination knowingly or unknowingly, you can just harm the patient. If patient has come to you and he's more than 50 years and he is having severe pain, then just don't examine the patient. If a patient with major trauma and the night pain or pain at rest, if he isn't having progressive motor or sensory deficit, if a patient is having cell anesthesia while electrical sciatica or leg weakness or difficulty in urinating or fecal incontinence. And the last one is unexplained weight loss. He may have cancer, and so if somebody have come to you with cancer and you have seen them, so don't do the strenuous physical examination activity, like don't tell them, don't do the muscle testing or don't do the joint mobilization part. You have to be very careful while examining that patient, and if you don't know anything, then don't touch the patient. Okay, like if a cancer patient has come to you, okay, so you don't have to test them until and unless you have read their medical histories and all. Okay, so as a physio, what are our aim? The first aim is to reduce pain. Okay, when a patient comes to you, he always complain to you about pain, so you have to just cure their pain. The second thing is to improve their function, to reintegrate them to the ADL activities, that is activity of daily living. And the last one is to prevent the recurrence of low back pain. So right now, we treat low back pain with modalities, exercise, treatment protocol, self-management, and rest or common analgesic. In modalities, we generally use heat and cold therapy, TENS, IFT, UST, and laser. And in exercises, generally, we use flexibility exercises, aerobic strengthening and endurance exercises, school of thoughts which is basically your McKenzie techniques, Maitland techniques, and Cyrex techniques. These are the techniques which we generally use to treat the low back pain. Okay. Apart from that, we use the postural correction technique. And if a patient from the office background or he's from multinational company, he may come to you with back pain, then you can teach him work hardening also. Okay. When as a physio, we just demonstrate patient at some exercises, then we have to keep it in a mind that we have to follow the SID principle, that is specific adaptation to imposed demand. That which mean that if a patient come to you with some specific low back pain, then you have to identify his cause, and according to his cause, you have to design his or tailor his exercises. Okay. And these exercises will be according to his occupational history. Like if he's a office worker, then you will tell him to do more exercises. Okay. Because he has a tendency to sit for a prolonged time, and his core muscle will become weak. So your as a physio, your main focus will be on training the core muscles. Okay. Then just treating the cause. Like if you can give a short wave for the short duration of time, but that is not a phase of office worker. Apart from short wave, you have to train him of core exercises. Okay. And you have to tell him the frequency, like how many times he has to do. Okay. Then to what extent he has to do, for how many times he's to do, and what type of exercises you are giving to him. Like you are giving stretching exercises or strengthening exercises or aerobic exercises. You have to explain it to the patient. Apart from that, the patient may use self-management technique, like he may use hot pack or cold pack at the painful site, and he may you have to tell him to just quit the smoking, and he can use stretching and strengthening exercise for self-management. And in acute cases, you just rest for 1 or 2 days is sufficient with some common analgesic. Now, as a physio, we have to be specific about our treatment. So right now I'm going to discuss about the evidence which support our treatment. Okay, like a study conducted by Caroline Ben et al. In 2021 on the topic physical therapy for patient with low back pain in Germany. It is a survey. Basically, it reported that if a patient with acute back pain comes to them, they have treated them with mobilization of lumbar spine. They had treated them with heat therapy, behavior therapy, massage, and kinesiotaping. Okay. And when a patient with chronic low back pain comes to them, they have treated them with strength training, mobilization of lumbar spine, and endurance training. And with an application level of 31%, kinesiotap was the most commonly used, despite not being recommended. Okay. So this basically this article tell you about the treatment protocol which the researcher has used in chronic and acute low back pain. Another research et al. Titled that is Physiotherapy Management of Low Back Pain, a review of survey, suggested that for acute low back patient, they have used the guideline, like they have tell the patient or they have informed the patient and reassured them the course and nature of resolution of low back pain, which mean that they have tell them that if you are having acute low back pain, then it may get resolved in 2 to 3 weeks. You have to take rest, you have to move, or you have to just take some analgesic, it will be better. And if it is a chronic one, then it can't be cured, but we can reduce your pain intensity. So basically, they are telling the informations to the patient about low back pain. The next one is bed rest is not advised. They have not advised the patient to take bed rest, because if patient is taking rest for more than 1 or 2 weeks, 1 or 2 days, then it may exaggerate their pain. Okay, and it may affect their function level or activity of daily living. So you have to tell the patient that rest for 1 or 2 days, okay, but If it is more than 2 days, then the pain may get increased, or you may feel more stiffness. Okay, so the next thing which they have done is they have tell their patient to return to their normal activity, and when the pain has not cured, then after that, giving all this above mentioned exercises or tips, they have applied some spinal manipulation and mobilization. For the chronic low back pain patient, they have used multidisciplinary team treatment in an occupational setting. They have used cognitive behavior therapy approach. Cognitive behavior therapy approach, which means they have basically tell the patient about the nature of pain, how it can be cured, and what should be the mentality of patient towards the pain. And they have train the patients like you have to accept the nature of pain, and you have to know the nature of pain. So cognitive behavior therapy is basically they have to the physiotherapist has just trained the mind of the patient about the pain. Okay, so the next thing which they have done is supervised exercise tailored for the patient. Apart from that, all treatment should be based on biopsychosocial model. Biopsychosocial model means they have just identified the therapist has just identified the nature of pain and psychological factors, like they have seen the patient whether he's feeling depressed or anxiety or not, if he's taking drug or not. Uh, After evaluating all those factors, the therapist has tailored the exercises to the patient, and they has just demonstrated them and tell them to perform it. After that, they have used the back school thoughts, and for a short course of time, they have used mobilization and manipulation. So summary of exercises which has been used in low back pain, that is when a patient come to a therapist, generally physiotherapist just advise or educate the patient. They will teach them general exercises, they will teach them stretching exercises, then therapists will do mobilization. Apart from that, they will use some machine like interferential or ultrasound. Apart from that, they can use some massage technique, hot packs, McKenzie traction, manipulation, stabilization, electrotherapy, and home exercises. Out of these exercises, the most common one is education, that is postural education or advice to the patient. And we have, after that, we have just tell the patient about home exercises and general stretching and strengthening exercises. Now the next recent article, that is randomized control trial done by Paul in 2020, concluded that individual treatment involving pain neuroscience education plus motor control exercises is more effective at improving pain intensity and disability compared to group-based exercises, while no significant difference were observed for fear avoidance belief and self-efficacy compared between the two groups in patients with chronic low back pain, which means that if we train the patient with pain neuroscience education and motor control exercises, it will be much better for them. Okay, so now when it's come to the different exercises which we use in or which we use for treating the low back pain are manual therapy, that is which includes the high velocity thrust technique like manipulations, low velocity or and these are the exercises which has been proven to be effective in treating low back pain. Okay, apart from that, there are some other exercises that is physiological, which follow the physiological principles and mind body exercises, like we can use tai chi, yoga, and we can use pilates and motor control exercises. Okay, and some psychological principle like graded exposure and graded activity has been shown effective in treating this low back pain. Apart from that, there are few or mixed support about acupuncture. There are few studies which show that acupuncture is effective in short term And this conclusion was supported by a 2015 review. Okay. So another research, which is best evidence rehabilitation for chronic pain, part 3 low back pain. This study was done by Annalene and his colleague in 2019 on chronic low back pain. And they have concluded that do not consider the use of therapeutic ultrasound, kinesiotape, TENS, massage, and osteopathic intervention, because they have after doing their research, they have concluded that these exercises are not beneficial for chronic low back pain. Okay. Apart from that, they have told that pain neuroscience education and spinal manipulation therapy has some positive effect, but should not be used as a standalone treatment. Okay. So here's some the pain neuroscience education, which means that you have to tell the patient about the nature of pain. Okay, if he's having chronic low back pain, then you will tell him that your pain can't be cured, but we can reduce it. Okay, you have to accept it. You have to control your anxieties and depression. So basically, pain neuroscience just help us to collaborate exercise with psychological factor. Okay, considering this modalities only as a part of treatment package include exercise with or without psychological therapy. The next thing which they have concluded that do not consider back school sensory discrimination training and proprioceptive exercises and sling exercises for low back pain or chronic low back pain patients. Okay, the next thing they have told us that exercise therapy is highly recommended, but it is not clear which duration, intensity, and method of the training are best. So right now we don't know to which duration or to at what intensity we should we should tell the patient to do exercises. Apart from that, the last thing they have told us that consider a combined physical and physiological intervention incorporating cognitive behavior therapy to maintain positive effect at long term. Okay, so there are few guidelines which has told that in chronic low back pain, we can use exercise, motor control exercises, tai chi, yoga, then psychological therapy and multidisciplinary rehabilitation. All this above mentioned exercises are beneficial in chronic low back pain. And when it's come to flats, acupuncture, spinal manipulation, and low laser therapy, we have seen that there is low evidence or there is low efficacy rate on treating the low back pain. So the efficiency of these exercises are not clear. And what we shouldn't use in chronic low back pain are lumbar support and taping. These are not going to help the chronic low back pain patients. So if you are using this technique, so you have to stop now. Another same article and that is given by National Guidelines Center has recommended same thing like earlier I have told you that self-management exercises, manual therapy, cognitive behavior therapy, multidisciplinary approach, or return to work and normal activity. They have also recommended not to use opioids, postural exercise or education, orthotic base, traction, acupuncture, ultrasound, and percutaneous electrical nerve stimulation, TENS, and interferential current in chronic low back pain patients. Okay. Now, a study done by Caroline in 2021 study shows that hypnosis and TENS with pulse duration of 2050 microsecond and frequency of 100 Hz decrease the intensity of chronic low back pain with no statistically significant difference between them, but statistically significant from the pain education control group. Another study that is a systemic review done by Given Mithin in 2021 found that ultrasound therapy of 1 megahertz and 1 to 1.5 watt per centimeter square would be an alternative treatment to reduce the intensity of pain in subjects with non-specific chronic low back pain. A review on interferential current analgesic effect in individuals with chronic low back pain done by Demetrios in 2021 shows that IFC of 4 kilohertz and 100 hertz have positive and immediate effect on pain relief in chronic low back pain patients. However, it should be noted that it should not be used as the monotherapy when the goal is long-term, resulting and not just the immediate immediate and temporary positive effect. So after reading all this above evidence-based practices, now it's time to do some conditioning exercises. Basically, conditioning means to train or to become physically fit by regime of exercises, diet, and rest also. So if you are having a low back pain, then or if your patient is having low back pain, then you have to tell them to do some aerobic exercises. You have to just tell them to correct their posture. Apart from that, you have to tell them to lose their weight, and you have to advise them some exercises like Tai Chi, Pilates, yoga, or gym classes, and even swimming. You can advise swimming. Swimming is the best exercise. Okay, so conclusion of this studies and this evidence-based studies has shown that the Chris Meyer has done a study in 2017 which suggested that identification of lower back pain phenotype with either an identified patho-anatomical basis or defined through clinical reasoning will probably open up a new approach to management that directly target the cause of the low back pain and its consequent disability, which means if we can categorize the low back pain according to their pathoanatomical basis, then it will help us to treat the main cause. Okay, we will just treat the causing factor and we can prevent the low back pain from occurrence. Okay, this understanding has the potential to help many people with disability, with disabling low back pain worldwide. So as we all know, prevention is better than cure. So there are popular interventions to prevent low back pain that are based around the limiting exposure to risk factor, which means that if you can identify the risk factor and you can limit them, then you can prevent the occurrence of low back pain. For that, you can use lifting devices in your workplace. You can raise to the support to the spine, and you can use the ergonomic advisors for your office furniture. Apart from that, graded activity are promising treatment approach for the prevention of low back pain, and explaining the physiology of pain can also work preventive. So one tip for you all is one way to get rid of low back pain is to stretch quadratus lumborum daily, especially if you sit all a day. So now it's time for the myth buster. Back pain is common. So are the back pain myths are? So first myth is always sit up straight. So as all we know that most of physio advise some patient that you have to sit straight, but it is not true. Slouching is bad. Slouching is bad for your back, but sitting too straight still for a long period of time can be strenuous on your back. So you have to tell the patient that you have to change your posture in every 20 minutes. Okay, don't sit straight for too long. You have to bend, you have to twist also, you have to get up and walk for a while. Okay, the second myth is to don't lift heavy object. Okay, it is not necessary how much you lift, it is how you lift. Okay, when you lift, squat to the object with your back straight and head out. Stand up, use your leg to lift the load. Okay, so if somebody has come to you with a severe back pain, don't tell them to lift heavy object. But when his pain has come down, then you have to teach him like how he can lift his heavy weight. Okay. The third one is bed rest is the best cure. Okay. As I have already told you earlier, that bed rest can be helpful, but it should be up to 1 or 2 days. But it's a myth that you should stay in a bed. Okay, a day or two in a bed can make your back pain worse. The last myth is for back pain. It's a big myth. Regular exercises prevent back pain, and for people suffering an acute injury resulting in low back pain, doctor may recommend an exercise program that begin with the gentle exercise and gradually increase in intensity. Yeah, as I have told you earlier that if a patient come to you with a severe pain, then don't just go for the difficult exercises. Start with minimal isometric exercises. Even in isometric exercises, he's feeling pain, then just don't disturb the patient and give him 1 or 2 day rest. But tell him that after 1 or 2 days, you have to do some exercises, like you have to do isometric. Then after that, you will tell him to do some bridges, and after that, you can just progress or gradually increase the exercise intensity. Okay, thank you. Over to you, Bilal.
If anyone have any questions, ask. I think we don't have any questions, ma'am. Thank you for the amazing session. It was really an eye opener. So with this, I will conclude the session. Thank you all for attending, and thank you, ma'am, very much for the class.
Thank you, Bilal. Have a nice day.